Hello, and thanks for joining us for this video case tip. I'm Bryn McBride of ABC for Health. Today we're taking a quick look at the proposed rule on the Affordable Care Act, the market stability rule that was introduced on February 15th. It's called the Patient Protection and Affordable Care Act Market Stabilization Proposed Rule. Now, it is just proposed. This means that it has not been implemented yet. The federal government has to allow time for a public comment period. Then they will take some steps to potentially revise the rule and then issue a final rule. This comment period is very short. It's only open for 20 days. Traditionally, they're open for 60 days, which means it's going to close on March 7th. At the end of this video case tip, we're going to give you information on, if you want to comment, how to do so. What the rule does is propose changes to the Affordable Care Act without dealing with the conversation happening in Washington right now about potential repeal. With the change of administration came the talk of repeal and replace of the Affordable Care Act, which started to get the insurance industry a little bit nervous. There was a little chaos in determining what could happen over the next year and potentially into 2018 with the talk of repeal. Yet, insurance companies still have to sell plans in the next year. So this was introduced by the new administration as a stopgap measure to try to stabilize the markets before any potentially big changes on the horizon were to come. Now, this concern about insurance company uncertainty for their future led to what is being called this response. It's going to be a little response to stabilize the industry over the next year so that they can sell plans in time for 2018. Now, there's a lot of political chatter that goes around this, and you can actually see a lot of that in the drafting of the rule itself. But let's talk about a little bit more about what this rule proposes. First, it shortens the open enrollment period for the end of 2017 to start from November 1st and run only until December 15th. The shortening of the open enrollment period has been said by advocates to try to chill enrollment, to try to keep people from signing up for the Affordable Care Act and for marketplace plans. We know that there's usually a big surge right at the end, and that these past years, that end has been the end of January of the following plan year. Now, even though that meant people had a short gap in coverage, it still was an opportunity to catch some of those folks that weren't very quickly signing up for coverage. What else does this proposed rule do? It looks at verifications for special enrollment periods and creates what's called pre-enrollment verifications. Now, there are some items that folks, when they have a qualifying life event, have to submit to the federal government to verify that that qualifying life event actually happened. The verification rule in the proposed rule adds more pre-verification items. If you plan to get divorced or have just had a divorce, which means your family size has changed, you're going to have to verify the divorce before you're able to enroll with a special enrollment period. The rationale for this, we'll take a look at this in a little bit. There was a lot of talk by insurance companies that they believe individuals and consumers are gaming the system, waiting until there's an illness to sign up for coverage and taking advantage of special enrollment periods to gain insurance after open enrollment had already closed. Now, there isn't any data that we can see or that any other groups have found that will support that claim, but it is the rationale behind why they're trying to tighten up special enrollment periods. Another change, an individual is required to pay all of their past due premiums before new coverage is allowed. That's actually changing the interpretation of some of the rules that are in the existing Affordable Care Act, and we'll look at that in a little bit as well. Other changes, the proposed rule lowers the actuarial value of plans. Now, that sounds like it's kind of a bookkeeping comment, but it actually is doing is changing how much premium you pay. It, in essence, lowers the premium by exchanging that for higher out-of-pocket costs. You will find that, what I'm saying, silver is the new bronze. If you had a silver plan in the past, what you're actually getting now is the quality of a bronze plan. You're paying a little bit less in premium, you're getting a little less coverage, and you're paying a lot more in out-of-pocket costs like deductibles, co-pays, and co-insurance. What does that mean when you lower your premium amount and you pay more out-of-pocket? A lot of things, but one thing for sure, less premium tax credit is coming your way as well. A couple more changes. Insurance companies get more time to set their rates. Network adequacy is adjusted. Plans don't have to include as many essential community providers as they have to right now, and that's things like community health centers and Indian health service providers. They lessen the regulatory burden on insurers, and they give more authority to the states. Now, these last two bullet points, lessen the regulatory authority and give more authority to the state, are two talking points that we've seen over and over. And a lot of the proposed changes and the proposed replacement plans for the Affordable Care Act coming out of the current administration and members of the House and Senate. What are some shortcomings of this plan? For one, it seems to definitely be decreasing consumer protections in the marketplace, plain and simply. It's instead putting the interest of the insurance companies first. And the rationale of the proposed rule even says that flat out. This is responding to the concerns from the insurers. They want to make it a little harder for folks that have illness or sickness to enroll in the marketplace. They, again, like we said before, insist that people are gaming the system and waiting until they're sick to purchase insurance. And they're adding verification requirements, which we know discourages people from enrolling in coverage. If you throw more hoops and hurdles in the path of someone getting to an insurance plan, they're not going to get to that plan. What does that do? It reduces access to care. It's also exposing patients to financial risk. And this isn't my words. These are the rules that are as written in the rule. They say this is possible when you put more verifications in the path of consumers that they're going to be exposed to more financial risk. What that means, more expenses are being heaped on the consumer. And also coming right from the proposed rules language, it could deter younger, healthier enrollees. What we know hurts the risk pool. One of the impetus for suggesting changes to the insurance market and who's eligible for it in the first place was the reality that when open enrollment first started, when the Affordable Care Act was implemented in 2010, it got rid of pre-existing condition exclusions, marketplaces opened in 2013, and we found that a lot of people that hadn't had access to insurance in a long time finally could gain coverage. This meant that a lot more people with health conditions and illness signed up for coverage. The risk pool was a little sicker than people intended. A lot of healthy young invincibles didn't sign up for coverage right away. There's been a lot of massaging of the rules and a lot of suggestions coming from a lot of parties of how to balance out that risk pool. Some of these market stabilization proposals had that in mind. How can we get more healthy young people to the marketplace? Well, the problem is a lot of the changes that were recommended in this proposed rule don't fix that. They could actually make that risk pool a little bit sicker. They also change fundamental interpretations. This is what I mentioned before. They changed definitions of guaranteed availability of insurance. And this was with that premium rule, that if you hadn't paid your premium, you're not going to be allowed to get any coverage of any kind until you've settled your debts. That changes the way that traditional insurance has operated. And that's a big change. And it's something that will impact families instantly. If they have an overdue bill of any kind with their insurance company, a missed premium, they're not going to have access to coverage. A couple other shortcomings. We mentioned the silver is the new bronze. That lower actuarial value will mean lower premiums, which could be good for some folks, but we know that this emphasis towards high deductible plans is going to really keep people from using their care in the way that they should. If you have to pay a really high deductible, people actually don't use their insurance as much as they could if they actually paid a little bit more on the premium side instead of out of pocket. And as we said before, lower premiums and higher out-of-pocket costs means lower premium tax credits coming the consumer's way. We also mentioned very quickly with that changed rule about network adequacy that this could actually harm some community health centers and Indian health services providers that would be excluded from qualified health plan networks if this rule were to take effect. Go ahead and read this rule for yourself. We have the link to it here, and you can click on that and read that. Make sure if you want to comment, here's the link to do that. You can click on the information button on your screen and submit your comments electronically. Make sure you do it promptly. They have to be received by March 7th. And remember, there are some real changes that could be made to improve and enhance consumer protections in the marketplace and in the Affordable Care Act. There are things like the family glitch that could be fixed with a very simple rule or with a quick act of Congress. Something to go through the legislature that everybody could agree on would help affordability in the marketplace. This proposed rule does not do that. They're taking a look at only the insurance company interest and not looking at the consumer interest that we really could have some great reforms to make the Affordable Care Act work for everybody. Thanks for joining us for this video case tip.